This is Dentist Fortune. Today we're going to be talking about what is cracked teeth. We'll be sharing some gems, so please stay till the end. So as always, there's a disclaimer. The information shared on this YouTube channel is for general informational purposes only. While we emphasize that dental prevention is better than cure, any content created on this channel should not be considered professional medical advice, diagnosis, or treatment. Always try to seek face-to-face consultation. So today, we're going to be talking about cracked teeth. And please stay till the end. We'll be sharing some gems. The learning outcomes. 1. What is cracked teeth? And 2. Why is it important to know? So what is cracked teeth? So it can be defined as an incomplete fracture of your tooth structure. So it could be visible or invisible. So there are times you can see hairline fractures on people's teeth, or it is fracture involving the enamel or dentine, and it is very difficult to detect it. It can often progress if untreated and is very common in the posterior teeth. The reason is because we use our posterior teeth to chew. So it takes a lot of the pressure compared to the front teeth. So how do we detect it? The only way to detect it is when you start having pain. You as a patient will come with pain. And as I said earlier, detecting teeth fracture is very difficult because you can't see it with your eyes, but you can feel it. So for example, maybe you tried opening a drink with a bottle or you've bitten into something hard. It may split the tooth in half and I can't see it. But anytime you bite, there's a gap and you feel the pain. So the test we carry sometimes is trying to get you to bite on something soft. And if that is called a fracture test to see whether it is positive or negative. So if I get you to bite on a cotton roll, for example, if there is no fracture, you don't feel pain. But if there's a fracture, you feel pain. And also we take radiographs. Some is very difficult to see it visible, but you are aware of it. And there are some you can use a probe to see where the fracture is. Some is fractured mesodistally most of the time. So if it is fractured like that, it could be you've bitten into something or there's a large filling. So it could be a buccal fracture or a palatal or lingual fracture. In that respect, when you put the probe there, you can see it splits, it gives open a little. So you can leave the probe there and then take a picture and it shows on the x-ray that there's a fracture. And some of them, you may think it is just a little fracture, but when you numb it and you try to take that piece off, you realize that it has gone all the way to the root. If it's gone all the way to the root, then you don't have any option than to have the whole tooth removed. But if you're lucky and it's only part of it that is fractured, then we can numb it up, take only the fractured piece and leave the rest, and then build it up and then crown the whole tooth. But you must bear in mind there's a risk of a root canal treatment in the future, or you can go for elective root canal treatment. That is root canal treatment before the crowning. But you can do all those things and still be in pain and need the tooth removed. I've seen instances whereby you look at the tooth, there's nothing wrong. You carry out all the tests, and the patient still tells you, I'm still in pain. And meanwhile, you can see that the tooth looks whole. I remember a scenario whereby the patient said, oh, I'm in pain, and we couldn't find anything wrong, and went somewhere else and had the tooth removed and then was free. So the lesson I learned was that if someone has got a tooth fracture, which I cannot see, and they can feel it and they're in pain, it's not visible. You've carried out all the tests, everything is negative, but the patient keeps on saying, I'm still in pain, then the only option is to have the tooth removed. But it's best to keep an eye on it for some time before making that decision, because losing your teeth is like bereavement. So you need to take your time to arrive at that decision. And what are the causes? So biting into hard stuff. Some people have got the habit of biting into ice, nuts, or candy, or something that is very hard. They bite into it. Some people also have got the habit of trying, maybe there's not an opener to open a bottle of drink and they are in a rush to drink and then they use their teeth to remove the cover. That can break your teeth. And some people get stressed and they grind their teeth at night and they are not aware of it, or they clench their teeth. That can also lead to cracked teeth. And then some people have got big fillings. If you've had a filling for a long time, at times, if you go and bite on something on that tooth, it may fracture because it's got a large restoration in it. So you've got to be very careful and avoid biting into hard stuff. And it could be trauma. Somebody could fall or have a fall or something like that, and it may lead to fracture of the tooth, which is quite visible. So, for example, someone is playing sports. That's why it's very important to wear a gum shield when you are playing sports. You're playing sports and then you fall over and then you chip your front teeth or something like that. That is crack. So that one is quite visible. But the invisible ones are the difficult ones to treat. Or there are some people you see fracture lines on their teeth, and those ones we can cover it with composite. So the treatment or thermal stress changes, hot and cold, can also lead to fracture lines. They may not be in pain, but when you look at the teeth, you can see some fracture lines. And how do you treat it? So you keep an eye on it, active surveillance, or you can do composite bonding, or you can crown the tooth. You can also do root canal treatment to take the nerve out. But if you do all those things and the patient is still in pain, then there's no other option than to have the tooth removed in severe cases. Some of the complications are pain, abscess, the death of the pulp, and tooth loss. So these are things you need to consider. So how do we prevent it? Prevention is always better than cure. One, try and avoid biting into hard stuff. So if you've had your tooth knocked out, try avoid biting into anything hard. And also, if you grind your teeth at night, you can have a custom made soft bite guard made, like the one showing in the picture, which you wear at night. So we can have one at a time. Some people prefer upper, others prefer a lower one, which you wear at night to break that habit. And you can do gentle jaw exercises to prevent you from grinding. That is curling your tongue to the roof of your mouth and then closing gently. Or when you are yawning, support your jaw. And also, whatever is causing you stress, try to work on it so that you don't grind or wake up in the morning with a clenched jaw. As always, thank you for staying till the end. Very much appreciated. And please subscribe for updates and share the knowledge. Thank you and see you in the next.